Well, first of all, let me say how pleased I am to be back in the kingdom again and have an opportunity to share some thoughts with you about healthcare and how we're evolving. There are 3 points that I'd like to make, and many are despairing about the future of healthcare and the planet as the population increases and we see increasing disparity of care across the country, across the world. And I would simply point out that I think that we're going to continue to see prospering healthcare across the world and the major factor driving that, I think, is going to be the tremendous increase in communication and the explosion of the ability to rapidly disseminate technologies across all sorts of areas. Secondly, you've heard a great deal about increasing technologies, and I would agree that genomics is one of the major advances that we will see in the future. But coupled with that will have to be our increasing use of information technologies, particularly around the electronic medical record, as medical care has now gotten so complicated. The total body of knowledge is doubling every 2.5 years, beyond anyone's individual capacity to maintain that ability to handle all that knowledge. So electronic medical record with increasing prompts from the electronic medical record are going to continue to improve where we're going. The third thing that I'd like to speak about is perhaps the most important thing that affects nations all over the world. And that is the explosion in population, the explosion in technology resulting in an explosion in cost of healthcare. In the United States, the cost is now 17% of the GDP. And we lead the world in this, but it is growing rapidly in countries all over the world. And what we really need to do is focus not just on costs, we need to focus on the value for the dollar of healthcare delivered. And that means driving quality and lowering costs at the same time. There are a number of things that have begun to affect that. First of all, cost. There's only a few ways that we can reduce the cost of healthcare. The first is we have to have a more efficient healthcare delivery system. We're now having a whole body of knowledge that is developing around the science of healthcare delivery. Examples of that are happening all over the world. In the United States, we have things called minute clinics, where you can go to your local pharmacy, and the Cleveland Clinic is involved with this, where you can get your immunizations, your strep throat swabs, etc. Kaiser and the Cleveland Clinic, fully integrated healthcare systems that go all the way from the very most mundane daily care to the most complicated programs. We have to see hospitals cooperating with hospitals. It's no longer possible that all hospitals can be all things to all people. We need to have specialists, hospitals, and move patients, and transportation has allowed us to do that. Similarly, we need to have physicians collaborating with hospitals. The days of a single individual being able to deliver care are past. It's now teams of people who deliver care. Then the second way to reduce cost is by prevention. The statistics are really quite staggering. 40% of the premature deaths in the United States result from 3 things: smoking, obesity, and lack of activity. Obesity alone now accounts for 10% of the healthcare bill in the United States. It's projected to go to 20% of the healthcare bill in the United States in the next 10 years. We will never bend the curve of cost of healthcare unless we attack the epidemic of obesity. Then quality. In order to drive quality, we have to learn how to measure outcomes in healthcare. This is not just measuring whether someone survives an operation or not, but measuring the cost of healthcare over the entire episode of a disease. In other words, If you have a hip transplant, it's from the time that you're diagnosed to the time you're back to be a functioning member of society. If you're in heart failure, it is the entire lifetime of your care in heart failure. So we must measure the outcome and subsequently the cost so we can get to the value. And finally, in order to drive quality, we have to have exquisite transparency around these outcomes. A number of years ago, we began to publish outcomes books, measuring actual outcomes of procedures by every department at the Cleveland Clinic. We put that on the internet. Subsequently, other individuals have done the same thing, so we allowed to compare results. It's only through comparing results that we were absolutely going to talk about delivering quality, not reputation. I'm very optimistic about our future in healthcare. If we can continue to gradually improve the technology, if we can continue to optimize our communication, and if we drive to value for a healthcare dollar, we will be successful in bringing a brighter future to the people of the world. Thank you.
Thank you very much, Doug.